World Breastfeeding Week are to inform people about their role in the strengthening of the chain as a support to maternal breastfeeding, to establish breastfeeding as a part of good nutrition, food security, and reducing inequalities, interacting with people and organizations from the entire support chain to breastfeeding, and having an impact on action in order to strengthen the capacity of stakeholders and systems to bring about a transforming change. As we all know, the COVID-19 pandemic and the geopolitical conflicts have expanded and deepened these inequalities, bringing more people to food insecurity. Breastfeeding is perfectly well designed for immunological and nutritional needs of infants and helps prevent infections. Breastfeeding promotes bonding between the mother and the child without considering the site, and provides security to the newborns, contributing to the security of the entire family. In the region of the Americas, around 50% of all newborns receive breastfeeding during the first hour of life, something essential in order to save the life of newborns. 38% receive exclusively breastfeeding for 6 months, and 32% continues with breastfeeding for 2 years. In connection with the implementation of the International Code of Marketing of Infant Formula in the region of the Americas, only 2 countries are dramatically alienated with the code. Some are moderately connected to the code, and 8 have some provisions of the code included in their norms. All the other countries do not have legislation that includes the provisions of the code. So we still see that there's a lot to be done in the region, particularly in the countries that still have not made any progress in their legislation. A multi-country recent study conducted by WHO about the way in which the marketing of infant formula has an impact on the decisions made by mothers regarding infant feeding found that most of the mothers or pregnant women have heard or seen some propaganda, advertising, or some other ads on infant formula. The influence of social media makes that the marketing of these is much more difficult, and that the influence on families and health workers is even more difficult to control. In a joint statement, the DG of WHO and the executive director of UNICEF have stressed the vital importance of breastfeeding in the current situation, urging governments in order to assign more resources to the promotion, protection, and support of standards and programs for breastfeeding, in particular for the most vulnerable families living in situations of emergency. This webinar will allow countries that have been successful in the implementation, education, and support of the recommended practices for breastfeeding to share their experiences, highlighting the effect of the double burden of malnutrition and the food systems, as well as the Sustainable Development Goals, in the way in which PAHO has contributed to the process. So once again, welcome to this webinar of the Global Week, World Breastfeeding Week. So now let us hear and let us watch a video about the practices in the industry of various formulas. We'll see this video on how they market these products of infant formulas. Can we show the video?
Yeah.
What do you see? The beginning of a new family. the industry for infant formulas, a new client. You see, difficult times, difficult moments for child rearing. They see an opportunity to sell their products. You see a group for mutual and virtual support. They see direct access to potential clients. They see many new forms of increasing their sales, and they don't know any limits. Let's place babies ahead of a profit.
Muchas gracias.
Thank you
Entonces,
very much. Now, in keeping with the rest of the agenda, we move on to the first presentation. And so I'd like to remind you that all your questions and comments can be included in the Q&A, that is to say, questions and answers, as well as in the chat. And in the course of the webinar, we will try to answer all your queries, be it during the guided discussion, as well as in that same tab of Q&A. So now I'd like to introduce Dr. Audrey Morris. She is the regional advisor in food and nutrition of our department, NMH, non-communicable diseases and mental health department, and she will be presenting the support of a PAHO for breastfeeding in the countries of the Americas. So let us now hear what Audrey has to share with us.
Good morning, everyone. I hope you can see me, can hear me. I hope you can see my screen. I'd like to be able to share my video, please.
You can do it. You can.
No, I
Right
cannot start
now?
video because the host has stopped it. Okay, there we go. Okay, cool. Good morning, everyone. And in this presentation, I'm just going to cover for you some of the work, the important work that we are doing as PAHO in the countries of the Americas. I'm presenting on behalf of the Department of Non-Communicable Diseases and Mental Health, NMH in PAHO, and we will have another presentation afterwards by Dr. Duran on some other work that takes place in PAHO. The protection, promotion, and support of breastfeeding requires coordinated actions during normal times and even so during emergencies. And the COVID-19 pandemic has brought to the fore the need for countries to continue their strong advocacy for breastfeeding as a public health intervention that saves lives and prevents infections and illnesses. So PAHO has continued to support countries in the promotion of breastfeeding and in adhering to the standard infant feeding guidelines developed by WHO. Why do we need to do this? The benefits of breastfeeding are well documented. We know that in babies, it has a short-term protective effect on reducing the risk of diarrhea, respiratory infections, otitis media, and sudden infant death syndrome. In the longer term, it has a protective effect on children, such as the reduction of dental malocclusion, overweight, obesity, and diabetes. Then breastfeeding over longer periods contributes to cognitive development. And for mothers also, breastfeeding decreases the risk of breast cancer, ovarian cancer, type 2 diabetes, and heart disease. And yet, even with so many benefits in the countries of the Americas, only around 50%, half of children initiate breastfeeding within the first hour after birth. and 32% go on to be exclusively breastfed for the first 6 months of life. Breastfeeding plays an important role in addressing all forms of malnutrition. And this includes overweight, obesity, the diet-related NCDs, as well as undernutrition and macronutrient deficiencies. So we see a role for breastfeeding there. And as we build sustainable food systems, we therefore have to include breast milk and breastfeeding for feeding our youngest members of society. Breastfeeding is also important in achieving the global nutrition targets for 2025. And of course, it's also important if countries are going to achieve the targets for the Sustainable Development Goals, especially goals 2, zero hunger, and 3, good health and well-being. A lot of the work that we do revolves around the Baby-Friendly Hospital Initiative. And this, of course, is a global campaign by WHO and UNICEF, initiated 30 years ago. The Bfhi recognizes that supportive healthcare practices are crucial to breastfeeding promotion. And the Bfhi centers around the 10 steps to successful breastfeeding. Now, the Bfhi has a core purpose of ensuring that mothers and newborns receive timely and appropriate care before and during their stay in a facility providing maternity and newborn services. So during that time, it's very important to enable establishment of breastfeeding. Revised guidance on the Bfhi was published in 2018, and this has an emphasis on scaling up to universal coverage and ensuring sustainability over time. So there's increased responsibility by countries. The WHO, in their new guidance, they listed 9 key responsibilities of a national Bfhi program. And these are depicted here. So first of all, we have national leadership and coordination, but then integration into national policies and standards, improving the training of healthcare professionals, the external assessment systems, incentives and sanctions, and the technical assistance to facilities. These are all a part of achieving national coverage. Then you have national monitoring, continuous communication and advocacy, and secure financing. And these are especially key to achieving sustainability over time. Now, how have countries been doing with this? We have this thematic, and this is using a new tool which is available on the PAHO website. It shows where countries stand regarding those key responsibilities for national sustainability. This was gathered from various sources, and we also recently conducted an exercise to determine member states' progress in strengthening Bfhi implementation. So most of the countries of the Americas are listed here. There are a couple that we are clarifying some information for, but you will see the 9 key responsibilities listed along the top here, and the country progress. So of course, green means that they have fully achieved that component. Yellow is partially achieved, red not achieved. And there are some countries and some components of this scheme that we have no information for some countries, and we will continue to be in touch so that we can know where you are and how we can continue to help you. So I'd invite you all to visit the PAHO website, and I'll share the link a little later so that you can see in detail what is there about your particular country. The first key responsibility that I mentioned, though, was national leadership and coordination. And as we said, that is important for both sustainability and continuance of the BFHI. And we have 15 of our countries that have fully achieved that national leadership and coordination. And of course, we want to move that number up. And so we continue to work with you. Our ongoing support for BFHI includes the establishment of BFHI networks for Latin America and the Caribbean. And we have representatives of government agencies from the countries in those networks, one for Latin America, one for the Caribbean. PAHO continues to do training in BFHI. We do training of trainers. Even during the COVID-19 pandemic, we have continued online to do training of assessors as well, who can carry out the external assessment. And presently, we are working on converting the WHO UNICEF course to online to facilitate more persons being able to make use of the training. We're also translating the BFHI training tools to Spanish, and that is near complete. We have been facilitating competency assessments, and this is a new part of the revised BFHI, the competency assessment. And there are some countries that are already trying to put this in place, and we're working with them to see how this can be done best. So we continue to support monitoring of the BFHI and periodic assessment and reassessment of maternity facilities. And that includes development and revision of tools. And in a broad sense, we're assisting countries in identifying the needs and opportunities for more fully integrating and scaling up the BFHI as part of broader efforts to achieve universal health coverage. Another large component of our work is on the International Code of Marketing of Breast Milk Substitutes. This is one of the key strategies in increasing breastfeeding and a very important set of recommendations to regulate the marketing, which means the promotion and sale of breast milk substitutes. In his opening, Mr. Nedavine already outlined for you, and you saw the video on the tactics that are being used in promoting breast milk substitutes. So we continue our work in advocacy for the code and in helping countries to include the code in their national laws. So to develop national laws based on the code. You see here, these are the two original. Well, this is the original document on the code. As we should all know, every couple of years, there is a World Health Assembly, WHO, a resolution to strengthen the code. And these resolutions are regarded as a part of the code. WHO has developed FAQs for the general public and for health workers. And there's also a document, an information brief on how the code implementation correlates with international trade agreements. In the latest code report, which we launched a couple of months ago, and you see the depiction here, what we found is that of the 35 countries in the Americas region, 19 countries have adopted legal measures to implement at least some of the provisions of the code. But of this, only 2 countries, Brazil and Panama, have measures in place that are substantially aligned with the code. And 9 countries which are moderately aligned, and 8 which have some provisions of the code. But unfortunately, there are 16 countries which have yet to enact any legal measures on the code. So the recommendations of that code report for 2022 is that countries should enact code legislation. Those which have enacted and which have only some of the legislation, they need to strengthen it. Strengthen this legislation, include products for toddlers, prohibit advertising, which we mentioned before, and prohibit donations of sample supplies and gifts. Countries need to build functional monitoring and enforcement mechanisms. And we as a UN organization, the UN Organization for Health, we continue with other partners such as NGOs and academia to support countries in implementing and monitoring. One of our main monitoring tools is the net code. There are two tools which have been developed by WHO for monitoring the implementation of the code in countries, or for countries which have not yet, and they want to do a periodic assessment or a survey type assessment. There's a tool for that, and we have been assisting several countries in carrying out this assessment to see how the code is being implemented, how well it is being implemented in their countries. PAHO's other support for breastfeeding includes the dissemination of up-to-date scientific information, as we're doing in webinars such as this, information products such as social media cards, social media campaigns. We have developed information briefs as well. So even during the pandemic, we have been doing our best to provide guidance for you, and we invite you at any time that there's a specific need in breastfeeding, Bfhi, code implementation. Please continue to contact us, and we will try our best to see how we can help you. Thank you.
Thank you very much, Audrey, for this very comprehensive presentation. Ahora continuamos con.
And now let us move on to the next presentation. And I'd like to remind you all that we have a simultaneous interpretation available. You have to go to the bottom of the screen where you see the globe, and you can find therein the interpretation. And if you click on interpretation, you can select between English, Portuguese, and Spanish, the language of your choice. Now, let us move on to Pablo Duran, the next presentation by Pablo Duran. He's a regional advisor of our Perinatal Health Latin American Center for Perinatology, Women's and Reproductive Health, CLAP. And he's a specialist in perinatal health. So as we know, he belongs to the CLAP, works for CLAP, as we call the center. So we're very happy to have you with us, Pablo, and to have your support for today. Dr. Duran will be talking about education and support to mothers and families of preterm babies, premature babies. Please go ahead, Pablo.
No te escuchamos todavía. Si puedes habilitar tu micrófono.
Could you please turn on your mic because we cannot hear you yet?
Okay, perfecto.
Perfect. Thank you very much, Leo. Good morning, everybody. It's a great pleasure to be able to participate today at this seminar within the 2022 World Breastfeeding Week. In this presentation, I'll focus on what Dr. Meren and Dr. Audrey have already said, to stress the relevance of education and support to mothers and families. But in this case, in the case of premature babies, we know clearly that breastfeeding supports the framework of well-known rights. And we also know, just as Dr. Audrey and Dr. Leverlin said, we know the benefits of human milk in terms of health, nutrition, and development, and many other aspects that are clearly important for the babies. But within our knowledge, the work to be done yet has been stressed. We need to promote from global and regional frameworks such as SDGs, the World Maternal Health Plan, and the National Plan of Health for Women and Adolescents and Children in the Americas to operationalize and transform, stressing the importance of breastfeeding, especially in a group, as we will see, in which premature babies, seriously ill babies, derive a very important additional benefit if they are fed with maternal milk. But the work still to be done points to emergent situations such as the COVID-19 pandemic, which has implied delays in the implementation of good breastfeeding. And in the case of newborns, premature and sick newborns, this has had an increasing impact, and there are still high inadequacies in the prevalence of stunting, low weight at birth, and all this will impact the mortality and disease charge in Latin America and the Caribbean. About 8.6% of births are premature births. 12% of babies are small for their gestational age. And of these, about 11% are newborn in term. But this has an impact at the immediate moment of birth that will require significant interventions that may interfere in the implementation of breastfeeding, but there will also be implications along the life course, because these failings will affect the growth and development of these babies. In absolute numbers, we are talking about practically 1 million newborns each year who are premature, and more than 1,400,000 that are small, have small size for the gestational age. So the care of premature babies or low weight or sick babies is very important to promote their survival and allow them to thrive. And for this, it's essential that the provision of health services should be promoted along two lines. The care, and in this sense, the health teams are a central and key personnel in the provision of quality care, but also the experience of care by families and mothers. And this calls for a definition of their communication, respect, participation, and communication so that the care is responsive, specifically by promoting and supporting breastfeeding since day one of life. And in this sense, the initiatives of childhood hospitals has a document developed by WHO, UNICEF, and PAHO, establishing the 10 steps to promote breastfeeding, but especially in premature newborns and sick newborns. In this sense, pre-birth and during birth care requires health teams that provide the appropriate care in terms of feeding for preterm and low birth weight newborns, and with educational programs that promote and strengthen knowledge, skills, and competency of health teams in newborns that will require specific care and interventions that delay or run counter the support of breastfeeding. So multidisciplinary teams with support actions to families and mothers to initiate and support and sustain breastfeeding, together with interventions such as the opportune tying of the umbilical cord and other measures. They're all leading to the start of breastfeeding. And secondly, I will only go into just a few details of the 10 steps for premature and sick newborns. Mothers and caregivers must be present with their babies. When breastfeeding is not possible, they need to resort to other forms of feeding with human milk, such as milk banks or the extraction of milk by mothers. All of this requires skillful personnel and well-trained personnel and a permanent interaction with newborns, mothers, and family. Thirdly, nutritive and non-nutritive breastfeeding are important, because we know that breastfeeding is not simply a means of feeding, but more than that, it promotes a comfort for babies and requires by caregivers and families a knowledge and a skill set for the feeding, both during the hospitalization and a very important second moment interventions. Upon hospital discharge, many times medical and nursing and nurse cares are more prevalent than the support to breastfeeding. So it is essential to provide elements to the family so that when babies are discharged from maternity care, that the family can and the mothers can have the knowledge and skills for breastfeeding once they go back to their home. And this also requires to provide follow-up mechanisms, counseling, and especially feeding plans at discharge that make it possible in the case of premature and sick newborns to provide the best feeding and care based on the feeding with human milk. That's why the information to be provided by PAHO is especially in premature and sick newborns. And the skin-to-skin contact between mother and baby, exclusive breastfeeding or with human milk, and cover kangaroo care at home and specific coverage for these babies at home. Together with this, at PAHO at CLAP, we have also developed, in addition to promoting the baby-friendly hospital initiative for premature and sick babies, these QR codes that allow you to discharge information specifically directed at caregivers and families and health teams in the framework of baby care of newborns, the feeding with human milk and breastfeeding. In this respect, and to conclude, the elements that we have stressed in this presentation is in terms of educating and supporting, is to stress the importance of feeding and the sustainment of breastfeeding, especially in sick newborns, because they are a priority population group for which the feeding with human milk has a significant role, especially in the reduction of the burden of disease and disability. So it is essential, as Dr. Mary said, it is essential to strengthen policies, but fundamentally the training of human resources in health and advocacy and effective communication to promote give support to families and caregivers of small and sick newborns so that these newborns can sustain breastfeeding even in clinical conditions that many times run counter to that. So I thank you all for your attention and I hand you back the floor to Leo. Thank you very much, Pablo. It is very clear that breastfeeding is maternal breastfeeding is essential for healthy newborns and on-term babies, and it is even more so in the case of premature babies with all the advantages that maternal breastfeeding entails. I want to remind you all that we are also recording this event and that after the event, the recording will be available in the 3 languages on our web page for maternal breastfeeding. And I also want to remind you that at the end of this webinar, we will have an open discussion and Q&A session where you will be able to ask your questions. And we also have this Q&A option where we can respond to questions live. Now we go to a panel with the experience of some countries. We have 2 representatives from Colombia and an intervention by Jamaica also. So presenters, please restrict your presentation to 10 minutes so as to leave some time for Q&A. I would now like to introduce Dr. Elisa Maria Cadena Gaona. She is the Nutritional Health, Food and Drinks Subdirector at the Ministry of Health and Social Protection in Colombia. Dr. Cadena Gaona, the floor is yours. Thank you. Good morning, everybody. It's a pleasure to be here today attending this webinar. I will present the Colombian experience in the development of the 10-year breastfeeding and complementary feeding plan 2021-2030. And I want to indicate that one of the main achievements in this development is to lead to a process in the health ministry in the previous years. And for this case, that leadership was assumed by the Presidential Council for Health. We see this as an achievement, and we stress this because promoting and protecting breastfeeding practices is very important from the health standpoint because we need to achieve the effects and goals. And for this, we need the action of not only of the health sector, but of whole of society. And we need to have the participation from the counseling. And this involved different governmental entities that participated in the process of the development of this plan. And we also involved other stakeholders that are very closely involved. This is a process that was started by the national government, and it is one of our flagships for the next 10 years. What was the development process? It's covered mostly 2021, but in 2020, we assessed the 10-year plan we had. And we had different challenges such as COVID, but even after confinement, we had a participatory construction that came from different regions in Colombia. Colombia has very different regions between cities and rural areas, and big differences between the North Coast and the Pacific Coast, and big differences between cities and tropical forests. And we needed to give room for the voices of everybody. So we called to participate in working groups, in working tests and interviews, where we interviewed mothers, their couples, their partners, and different in stakeholders having to do with the promotion, protection, and support of maternal breastfeeding. And then we conducted a validation process with experts and responsible for implementing this policy at a domestic level and at a regional and territorial level. So we involved everybody. It was a very participatory process, and we also included the most valuable individuals in this process, that is to say, the mothers, their families, and of course, the health personnel and other partners that can support us in this process. The plan is a conceptual framework that stresses the role of the mother and the babies from a rights-focused basis, and also there's a definition of the scope. We had a 10-year plan of breastfeeding, and we also had complementary feeding, because maternal breastfeeding is very important even after between 6 months and 2 years of age, but there also other food starts into place. So we need to define the feeding of the first 2 years of life of a baby, and there breastfeeding is very important. We need to define all the elements and the role of breastfeeding in promoting health along the life course. And to operate this, we based our work in the territorial focus and looking for social and institutional transformations. The 10-year plan addresses 3 key milestones for the implementation in the next 10 years. One milestone is that of introducing the importance of complementary feeding as one of the forms that promotes a good nutritional and health status in the population. A territorial focus, as I said, it's not the same to be in the capital or in the northern territories in Colombia. And so we recognize the different territories, identifying the actors' dynamics, the specific social cultural details, and the specific needs to promote breastfeeding and complementary feeding. And the third milestone is that there has to be social responsibility. Maternal breastfeeding and complementary feeding is a shared responsibility and shared commitment between the family and different actors in Colombian society. So we not only restrict ourselves to the health sector, we involve the whole of society. And in this sense, the plan has a general objective that is to improve the breastfeeding practice and adequate complementary feeding of young boys and girls. We have structured 4 strategic lines that will be developed from the national to the territorial level. One line is governance, integral care, integrated and complementary care. All of these lines involve all that has been said so far. PAHO, milk banks and counseling, the monitoring of codes and other activities. Another strategic line involves social transformation centered in protective practices, where we need to destigmatize breastfeeding in public, which had a big stigma in Colombia, and it needed to be destigmatized. And then we need to manage knowledge, because it's important to know what goes on. And knowing what's going on involves also knowing why mothers are not breastfeeding their babies. And if we learn about their barriers, we can solve them, overcome them. Why do they breastfeed or not breastfeed their babies? Is this better in one area or another? And in In this sense, knowledge management is very important. And we hope that with the implementation of these lines, at the end, we will have some impacts and effects that small children between 6 months and 24 months of age have an adequate nutritional state. We meet the Latin American average, but we need to move ahead to increase the number of adequately fed newborns. But we also want to breastfeeding to continue until 2 years of age, and also to improve complementary feeding. So we need to define a minimum acceptable diet. If we attain this, we will impact indicators of nutritional status and also other indicators such as the duration rates of breastfeeding and also an improvement in maternal health. But we also know that with breastfeeding, we will reduce the prevalence of low weight birth, and we will improve the health of the mother and sexual and reproductive age. And how do we expect to do this? We have strategic lines, actions, and milestones that will be within each of these lines. At the beginning, I mentioned that we work on a territorial focus, and this is important to stress that we plan this from a social participation framework implemented at the territorial level with a management model, which is the guide for territorial implementation, taking in detail all these actions, and we include them in different elements at the different territories, but we also look to see what are the objectives, what are the results we want to impact, what activities will be conducted, probably in some areas will not require the same actions as other actions. Then the coverage of the implementation of the plan, the time frames, we always need to establish deadlines to attain objectives. Who will be responsible for attaining the objectives? What resources do we have? Not only financial resources, but also human talent resources and other resources for implementation. And there's also a strong follow-up component, short, medium, and long-term follow-up to see how we are implementing all these actions. And this was my presentation. Thank you very much. Thank you very much. Very interesting, your experience. And thank you for showing the multiple benefits in the prevention of malnutrition, overweight, and obesity, and also the benefits for mothers. Now we can move to another presentation also, and seeing that there are several questions in the Q&A. In the Q&A, I want to ask to the specialist to type their responses in the Q&A. Now we invite Dr. Ana Luisa Ruiz. She's a consultant. She belongs to the International Board of Certified Lactation. She will explain the role of maternal breastfeeding and education in the breastfeeding world. Doctor, the floor is yours. Good morning. Thank you for the invitation. We are two participants who will address the experience in Colombia. I'm an OBGYN and I'm an international breastfeeding consultant for the last 7 years. I work mainly in the private practice, but I also are part of some agencies that work for breastfeeding on a private basis in my country and also in the region. Additionally, I also work at a big hospital in Colombia, and I'm also part of the construction of medical education processes at universities in Bogota. I will show you the scenario that I see frequently in my patients and the aspects that have a big impact in improving the quality and duration of breastfeeding in Colombia. Next, please. So, a very important message that everybody has very clear. To bring up, to raise a child, we need a whole tribe. This is very important because oftentimes we only place the responsibility to breastfeed on the mother. And this is not fair because we also know about the international power of milk banks, and we talked about baby-friendly hospitals, and the initiative has very important representations in Colombia, based not only in the breastfeeding, but also in the rearing on the first 1,000 days of life of a baby. But the responsibility of bringing up a baby, to breastfeed a baby, is not only lies on the mother. There's also the partner of the mother's partner, and the mother's family also has a big responsibility. And also we, health professionals, have a great responsibility because sadly, in most cases, we are those who end up by giving not clear recommendations. Next, Alejandra, please. Next slide. One of the most significant strategies, and that was also mentioned many of the previous presenters, is the importance of the skin-to-skin contact. We often think of the skin-to-skin treatment as a kangaroo care, and we also think of premature babies, but skin-to-skin is also key for healthy babies, regardless of their weight. Even if they are healthy and have good weight, skin-to-skin is some sort of institutional
el ginecólogo o
protocol.
el pediatra que están de turno.
And it's
Y
not
un
only
hospital
the
logra un
province of
100% de cumplimiento de piel a
pediatrician
piel en
on
primeras
turno.
2 horas de vida.
We need
Esto
a
hace un cambio
100%
diametral
compliance of
para
skin
lograr
by
mejores tasas
skin-to-skin
de
contact
lactancia,
between the mother
menores
and the
tasas
child,
de
the
depresión
newborn, in the
y
first
mayores
hour of
continuidades
life.
de lactancia a largo plazo.
And
Entonces,
this
el piel a
will
piel
entail, so
institucional
the
hace
institutional
un cambio de
skin-to-skin
mentalidad en la institución,
involves a change of
mejora el inicio y
mentality
la
in the
continuidad de la lactancia,
institutional
logra
institution.
mostrar
It
un apoyo
improves and the
institucional
continuity and
inequívoco
support of
a la
breastfeeding.
lactancia y genera
And
un
it
aumento de la
generates an
autoconfianza de
increase
esa
of
mujer
the
para poder lactar a su bebé.
self-trust, of
Y
the
este piel a piel no
self-confidence of a
debería estar
woman to
fomentado
be
solamente
able
en
to
las 2 horas
breastfeed
iniciales de
her
vida
baby,
o en
not
los
only
bebés
in the
prematuros,
first 2 hours
sino
of
el piel a piel y
life
los
of a baby
beneficios del
or
piel a piel que
premature baby.
todos
The
conocemos,
benefits
que
of
son
skin to
grandísimos,
skin that
deberían
there are
continuarse dentro de lo
manifold
que
and
se
we all
llama
know
el
them,
cuidado en
should
casa
be
del
part
recién nacido, que ya lo
of
habían
the home
mencionado dentro de una
care
de las
of the
estrategias
newborn,
importantes del
which was
cuidado en
already
casa de un bebé
mentioned
prematuro
as
de
one
bajo
of the
peso,
important
pero los niños
strategies
con
of the
peso
care of
normal
premature or
también se
low weight
benefician de una
babies, but
forma muy
also normal
importante
weight
de piel a
newborns
piel. Siguiente.
derive great benefits with us from the skin-to-skin contact with our mothers. Next.
Entonces,
So,
la educación.
education.
Y esto va tanto para las
And this
mujeres
goes
y las familias
both
como
for
para
women and their
los
families as
profesionales en salud. La
for
educación
health
prenatal
professionals.
es muy
Prenatal
importante.
education
No
is
podemos
very
esperar a dar
important.
educación cuando
We
ya la mujer tiene a
cannot
su bebé en sus
wait
brazos.
to give
¿Por qué?
education once the
Porque
baby
las
has been
primeras
born.
horas de vida y
Why?
la primera
Because
semana de
the
vida es
first week of
supremamente
life
importante
is
en unos logros
supremely
de
important
lactancia materna correcta
for
para poder hacer que
to
estas
have
mujeres
good
sepan qué
achievements
esperar.
in breastfeeding,
Porque no
so that
tenemos ni idea.
women
Acordémonos que la lactancia
need
es
to
una
know
cuestión
what to expect. We know
aprendida y
that
no tiene un componente
breastfeeding
instintivo
does
importante.
not
Entonces, como
have
nosotras no
an
hemos visto
institutional
eventualmente a
component.
otras
We
mujeres
have
lactar,
seen,
ni hemos hablado mucho de
we
eso.
have talked
Y
about
además
the
en Colombia
learning
tenemos
as
unas
you would
tasas
go
de
with
lactancia
breastfeeding. And in
exitosa y
Colombia,
exclusiva
we have
bajas,
such
igual a las de todas
low
las Américas,
achievement
pues entre más les
breastfeeding
vayamos
rates.
contando a las
The
mujeres qué
more
esperar y qué es
we
normal,
inform
es
women about
mucho
what to
más
expect
sencillo
before
poderles
the birth,
ahorrar el
the
problema que
childbirth.
he visto
It's
también que
more
aparece en todo el
important
mundo,
to prevent the
que a
problem that
uno cuando
appears
tiene su
everywhere in
primer
the world,
hijo
that
en los
even
brazos le dicen,
women, when
el
they
bebé se
have their
alimenta
first
20
child
minutos de un lado,
in
20
their arms,
minutos del otro,
well,
y
that
hasta
they
3 horas
breastfeed
después hay
their
que darle comida.
baby
Cuando uno
20
desde la
minutes
parte
one breast,
prenatal le está
20
diciendo a la
minutes the other.
mujer, eso que estás oyendo no es
What you're
correcto,
hearing
y
is
la
not
lactancia va
correct
libre de
because
demanda, y la forma de saber que tu bebé está
breastfeeding
comiendo lo
is
suficiente
demand-free. The
es
way
esta,
to
esta y
know if
esta.
the baby is eating
Todo
correctly
empieza
is
a cambiar porque la mujer empieza a tener unas
when the
metas y
baby
unas
shows
pautas que son mucho
satisfaction.
más
May
fáciles de
the
lograr.
woman starts
Entonces, el
having
acompañamiento
much more
durante la
achievable
lactancia
goals.
es
So
tremendamente
support during breastfeeding is extremely important,
importante.
starting with the pregnancy. Thank you. Next.
Entonces,
Then support during the first hours. Next.
tenemos mujeres.
We have women,
Estaba haciendo la charla y preciso recibí
and I was preparing the talk when I received this message. My baby was born, everything was okay. But today I went through a stress situation. And when I wanted to breastfeed Alicia, she was under stress and she was not able to feed. I don't know what to do. I feel terrible. And they said that I should extract just some droplets in a little syringe. After this chat, she said I was able to draw 2 centimeters of colostrum. And I'm told that this is not enough, that I better dump it. So always when a woman has who to go to during the first hours of life, everything works better. So the prenatal preparation, she had attended in a live presentation. She knew that colostrum came out in droplets, but because of the hormonal changes, because of the family pressure, the institutional pressure, as soon as she drew 2 drops or 2 centimeters of colostrum, and she decides that this is not enough and she will dump it, the whole confidence drops. So let us not forget that within education and breastfeeding, it is not only a matter of being there to support them. We have to validate the emotions and reinforce the confidence of these women. And the fact that she had someone to call, the fact that she knew that there was someone that could guide her, even if it were over the phone, leads to a very different result of the story. And after accommodating and finding the correct position with the breast and reinforcing her confidence, she leaves the hospital with exclusive breastfeeding without any problem. And this a woman sees that getting 2 centimeters of colostrum for the first 12 hours of life of the baby is wonderful, reinforces her confidence, and then she continues with the breastfeeding. Next. Another one of the strategies that is very important within the support is the creation of milk banks. Why? The next one, because here we have another example of where this permanent ongoing support can be of assistance. So on the green or on the black square, we have an audio, if you can help me hear it. This is a woman that calls me and tells me that she had a drip schedule, that the baby is undergoing exclusive breastfeeding, and she does not have any idea on how to organize this. I see that the audio is not working, so I'll tell you a little bit. This woman comes to me and she says, Anna, my baby is 6 months old. We're just starting with a complementary food. He's not eating enough, and I was just told that I have to leave on a trip. I don't have a great milk bank, and I'm leaving soon. I need 140 ounces of milk in my bank, and I will not be able to get that. Once again, I validate her emotions. I rest her assured, and I believe that I've already told
Hola,
this, so
doctora,
don't
¿cómo
worry
está?
about the audio. So she's repeating the conversation. Don't worry about it. So I validate the emotions and I organize a plan whereby we are able to get 140 ounces that are needed in order to be able to leave on a trip being calm. she didn't believe me, and she sends me the first picture that we have with Let's Start, when she was able to draw more than what she thought she was able to draw. And after some time, after 2 weeks, in spite of working, she sends me this message. Hello, Ana Lucia. Let me tell you that I have 140 ounces. I was able to do it for the trip, so I'm very happy. So what they need is some love and support in the process. That's all our patients need. So definitely education is very important, and there are several things that both in my country as well as in many other countries, in most of the countries, we don't say a lot of things, or we have that thing in our heads that breastfeeding is painful, that we have to hold it, that the nipples are hurt, that there's no way of doing this. And the way I see this education, there are a lot of things that have to be organized. And these are the ones in particular. We have to teach these women and the families and the health professionals the following. There must be being able to hook the baby to the nipple without pain. It is not normal to have lesions on the skin, that they don't need any preparation to be able to work, that counting the nappies is a strategy to know if the baby's eating what he has to eat. Because of simple marketing, we've been told and drilled in our head that we have to know how many ounces of milk our babies drink, and this is not true. So everything that comes in must come out, and counting the diapers and a regular behavior of a baby works well. Short goals, I always say, don't take the babies in your arms and you say, I'm going to breastfeed you for 4 years. No, let us start off with the short goals and clear objectives. Breastfeeding on your skin, contact with the skin, bonding from the first hour of life, but perpetuate this along the way and to learn and show them what are the real normal patterns and not those expected by a society that allows a woman to go out to work very early in the morning within the breastfeeding and the rearing and raising of their children. And that leads to things being different. Then next, with all of this at hand, Colombia has begun to organize many strategies, and the breastfeeding plan for the first time in Colombia will involve a large number of stakeholders in the process. And I believe that this time we will truly be able to mark a difference amongst all of us. Thank you very much. Thank you very much. A presentation with a lot of information and very helpful for the countries herein represented. Let us move on to another presentation by Jamaica, where we will be hearing about the support groups for maternal breastfeeding and how they have an impact in Jamaica. Breastfeeding support groups, and we have Marcel Turner-Pitt, acting director of nutrition from the Ministry of Health, making an impact in Jamaica. Please go ahead, Dr. Turner-Pitt.
Okay, good morning, everyone.
Good morning.
Okay, I'll be sharing with you a little about Jamaica's experiences with the establishment of infant and young child feeding support groups. Okay, please change the slide. Okay. Now, throughout the presentation, I'll be talking about the establishment of these
Sorry, we're
community
seeing
infant and young child.
We're seeing the note slide. Can you switch the view at the top? Display settings.
And please, those who are not speaking, if they can close the microphone.
Can you see my screen?
Cindy, go back to the PowerPoint.
Please mute your microphones if you're not speaking.
Debo de detenerlo porque estoy compartiendo, ¿no la ven?
Now go, stop sharing and go back to your PowerPoint. On the left side top, there is the icon to present.
One moment. I'm so sorry.
Okay, I'll go ahead and share my slides.
And please, there are some microphones open. Hay algunos micrófonos abiertos. Si pueden
There's some
cerrar.
mics open. If you're kind enough to mute your microphones, please.
I'm sharing right now. Can you see or not yet? Or
Cindy, at the top where it says display settings, at the top,
yeah.
you can switch to the other screen.
Oh, got it. Wait. Now?
Swap, yes.
Okay.
Great.
Thank you.
Okay, thank you. All right, so I'll be sharing with you a little on the establishment of community infant and young child feeding. Challenges experienced and challenges and some of the best practice. Share this time, change the slides. Okay, you may go ahead and change the slide.
Okay, we can see the second slide now.
All right, thanks. All right, please go ahead and change the slides.
John? I am in the third one.
Thank you. All right, so Jamaica is similar to other countries in the region in that we have a double burden of over and undernutrition. In fact, data from the State of the World Children 2021 indicates that for children birth to 59 months, 8% were stunted, 3% were wasted, and 7% were overweight. And the same data showed that early initiation of breastfeeding was 65%, and exclusive breastfeeding until 6 months was 24%, and continued breastfeeding in children 12 months to 23 months was 38%. Please change the slide. A number of strategies have been utilized to address these issues, including the development and implementation of a national infant and young child feeding policy, which has in it activities such as the implementation of the baby-friendly hospital initiative and the establishment and implementation of community infant and young child feeding support groups. In fact, the establishment of community infant and young child feeding support groups is in support of the implementation of step 10 of the 10 steps to successful breastfeeding. Now, over the past 6 years, a number of work has been done in support of the implementation of community infant and young child feeding support groups. And these activities include the training of over 250 community infant and young child feeding support group facilitators. And this was done over a 2 years period. And the establishment of community infant and young child feeding support groups in community settings, including health facilities such as hospitals and health centers, faith-based organizations such as churches, workplaces, community groups, and homes within communities. Now, in 2019, Jamaica launched the National Infant and Young Child Feeding Network, which comprises of the established infant and young child feeding support groups, as well as healthcare workers and family members and other supporters. of the caregivers. And since 2019, over 8,000 caregivers have been reached through the 37 community infant and young child feeding support groups established. And since 2019, each year, new support groups have been established. In 2020, despite COVID-19, Jamaica was able to establish 17 new support groups across the island. And these support groups reached approximately 3,700 caregivers. In 2021, 26 new support groups were established, some of them face-to-face and some of them on social media platforms such as WhatsApp. And these support groups reached approximately 5,300 caregivers. Now, the support group facilitators trained, they include healthcare workers, members of community, members of faith-based organizations such as women's group leaders or persons of influence in community settings. Please change the slide. Now, a number of factors have facilitated the successful implementation of these community groups, such as a strong linkage between the health teams. So you have different categories of staff coming together to ensure that the support groups actually meet. They conduct monitoring activities, they facilitate support group meetings, and they assist in the mobilization of the participants of the support groups. So a team effort is taken for this to work. Then the support groups, that is a priority at the national level. In fact, the Minister of Health and Wellness, the Honorable Dr. Christopher launched the Infant and Young Child Feeding Network in 2019, as mentioned before. So it's a priority. It's included in the National Infant and Young Child Feeding Policy. And so there is a budgetary allocation towards the implementation of activities surrounding the support groups at the national level. And there's also support from our international partners, such as PAHO and UNICEF, especially with the training of support group facilitators and the training of trainers, the provision of training materials and venue and refreshment for the training session with continued technical support. It is also a priority for senior managers within the regional health authorities. And we have found that when there is buy-in at the highest level, the support groups are more likely to be successful. And when in place, there is budgetary allocation for some of the activities. And to note is that the support group activities, the monitoring of these support groups, they are included in the work plan for the community health aides. So it's a priority for the Ministry of Health and Wellness. It's good also to note that a majority of the facilitators previously trained are still motivated and raring to go. They're still excited about facilitating these meetings and providing skilled support to the caregivers that are in need of the support. Please change the slide. All right, so despite the success reached, there has been a number of challenges, including insufficient support group facilitators. So the training started in 2016, and over the period, persons have migrated. Some persons are no longer interested in being facilitators, so the number of active facilitators have decreased. In addition to that, there are competing activities. So even though the support group implementation is included in the work plan of the community health aides, for example, they have other duties that they have to implement. And so that dedicated time is not there for the implementation. In some instances, there is inadequate funding. For example, funding for laptops or multimedia projectors to aid with the education of these members, support for funding for the development of videos to be utilized in these sessions so that it's more practical. And funding for the provision of refreshment, because we have found that when refreshment is available, the members are more likely to turn up and they're more likely to stay for the duration of the session. In some communities, there is poor internet connection. And so with COVID-19, where we have online support group activities, we have low response rates when there is poor internet connection. And for some persons, they're not able to afford to put data on their phone. And so they're not able to participate in these sessions. For the most part, persons use their personal phones, and with the WhatsApp groups being formed, the memory is used up, and that is an issue in itself. At times, it's difficult to find appropriate venue for meetings, venue that is large enough to accommodate the members in terms of the space, or appropriate in terms of the location, a safe area where persons can feel comfortable walking to, and a safe space as well where persons can feel safe sharing their whatever concerns they may have. And there is limited participation from some members in WhatsApp groups. So because it's not face-to-face where the facilitators can prod persons to participate, sometimes persons get lost in it. And whilst they may not participate in the wider group, they reach out to the facilitators. Please change the slide. So COVID-19 has impacted the implementation of these community infant and young child feeding support group, in that there has been decrease in the number of meetings held, particularly face-to-face meetings, and a decrease in the number of participants. And this is due to a number of factors, including unavailability of staff due to the COVID-19 response. So staff who would normally provide technical support, they have been reassigned to other duties related to the reduction of COVID-19. And then there were restrictions in terms of movements and time. So that affected the support groups. Persons were unable to move to the venues where the support groups were being conducted. And for support groups that happened later in the night, the COVID restrictions, the curfews affected those. Some persons were afraid of getting COVID-19, and so they just did not turn up to face-to-face support groups, despite the fact that masks were provided and sanitizers in some instances. So in the areas where you have highest positivity rate for COVID-19, those areas had mostly online support groups activities, whereas the other areas would continue with their face-to-face. Please change the slide. So a number of strategies have been employed to overcome these challenges, including allowing participants to suggest topics and the use of videos. So when participants suggest the topics for discussions at the next meeting, they're more likely to turn up because those topics are of interest to them. And for persons who get bored over the period, some groups utilize fun activities such as quizzes and giving incentives to those who correctly answered the questions, etc. So the facilitators had to be creative in keeping the interest of the members of the support groups. To address the shortage of facilitators, more additional facilitators were trained, and these facilitators were able to assist with the hosting of these support groups. In some instances, phone credits were given to some of the members. However, the funding for this came out of the pockets of healthcare workers, and hence the importance of including these activities in the budget. Use of online platforms such as WhatsApp group and Zoom for meetings, and reducing the number of persons in the WhatsApp group to have control over participation of the members. Light refreshment that was served in some meetings. Okay, please change the slide, and I'm wrapping up. So the best practices include partnerships with key stakeholders, such as RADA and PAHO, where persons were able to participate in income generating activities and get access to skills training as well. Support groups held in health facilities were held on the clinic days, so it was easier for caregivers to participate. Buying at the highest level, use of WhatsApp and online groups, and the facilitators allowing members to share in the groups instead of taking the lead all the time in the discussions. And active parish infant and young child feeding committees, which have the responsibility of monitoring the support group activities. Next slide, please. And the final slide for Jamaica funding is important. It is important that the activities are included in the work plans and funds are allocated for the implementation at the regional and the parish level. Capacity building is also a must, including the training of new facilitators and conducting follow-up training for existing facilitators. Provision of laptops, multimedia projectors, development of educational videos, and the implementation of a media campaign on breastfeeding itself, along with a media campaign on support groups. And promotion in communities, sharing of best practices on various platforms, and the targeting of fathers and grandmothers, because our local studies have shown that our fathers and grandmothers are very influential over how mothers choose to feed their babies. We also need to strengthen the partnership with our key stakeholders, including telephone companies for provision of phone cards, training institutions, and other community-based organizations. Thank you.
Thank you very much, Marcel Turner. A very comprehensive presentation of the work we are doing in Jamaica, and so very, very interesting presentation. So unfortunately, we have received excuses from Dr. Hugo López Gatell. Recibimos las excusas del Dr. Hugo López Gatell, el
Dr. Hugo López Gatell has apologized. He's the Deputy Minister of Health in Mexico. Unfortunately, he will not be able to be with us because he now has a conflict with his agenda. But before we go on to the discussion that will be moderated by Dr. Betsy Boutron, who's the Regional Advisor in Integrated Child Health, let us hear and let us watch a video that has to do with the presentation by the Deputy Minister of Health from Mexico. And maybe with that, I can give the floor to Betsy so that she can introduce the video, and then we will move on to the next part of our session with discussion and Q&A. And let me remind you that those of you who have questions to please include them in the Q&A app that we have at the bottom of the screen. So then, let me give the floor to Betsy now.
Betsy. Adelante,
Gracias,
Betsy.
The floor to
Gracias,
Dr.
Leo.
Betsy. Thank
Por
you,
favor,
Leo.
¿podrían pasar el video?
Could you please
Y
show the
después que
video?
termine el video, le
And
pediría a los
after
tres
I would
panelistas
ask the
si
three panelists
podrían abrir sus cámaras. Gracias.
to open their cameras if they can. Thank you.
Muchas gracias. Muchas gracias por pasar el video y muchas gracias por participar. Quisiera pedirles a la
Thank
doctora
you now
Elisa,
for
a
showing
la
the video.
doctora Ana
Thank you
Lucía y
for
Marcel,
participating. And I would now
si pudieran abrir
invite
sus
Dr.
videos.
Elisa,
Please, Marcel, could you please turn on your video?
Dr. Elisa,
Thank you. Thank you. Marcel,
and
are
Anna,
you
please
with us?
turn on your camera. Are you here with us? Marcel?
Yes, thank you. Thank you so much. En esta sesión,
Well, in this session,
quisiéramos escuchar de
we would
ustedes, tanto
like
los
to
panelistas
hear
como
from
los
you, both the
participantes,
panelists and the
¿cuáles
participants,
son sus ideas alrededor de cómo
your
acelerar
ideas
el
as to
progreso
how to accelerate
en
progress
aumentar la lactancia
in
materna
increasing
exclusiva
exclusive
y la lactancia
breastfeeding
materna hasta los 2 años,
and
además
breastfeeding up
de
to
dar
2
la
years of
alimentación
age, in
complementaria.
addition to complementary
Como
feeding.
ustedes han visto en las
As you have
presentaciones, hay
seen
mucho
from
que
the
se está haciendo,
presentations,
pero todavía
much
nos
is
queda
being done,
mucho por
but
seguir
there's
haciendo.
still much to
Y
be
están
done.
apareciendo nuevas amenazas,
New
sobre todo
threats
en lo
are
relacionado
appearing,
con el marketing
especially
digital y el
with
uso de
regard
los
to
medios
the
sociales
digital
para llegar
marketing, the use
directamente
of
a las
social
madres
media
gestantes.
to reach directly
Directamente están llegando para
pregnant women
influenciar y
who are
en
being
el uso del
influenced
biberón, en el uso de
in the use
las
of
leches
feeding
maternizadas,
bottle and the
pero
use of
además
baby
para
formula, but also
sembrar dudas acerca sobre la
to
lactancia
generate
materna.
doubts about
Entonces, tenemos un gran
breastfeeding.
reto
So
por
we have
delante y
a
tenemos mucho
huge
que se
challenge
está
ahead.
haciendo, pero
Much is
quisiera
being
escuchar de
done, but I would
ustedes
like to listen from you, to hear
¿qué nos
you.
sugieren? ¿Cómo podemos
What
acelerar
suggestions you have?
el
How
avance
can you
para que
accelerate
nuestros niños
progress
puedan recibir
so that
la
our
lactancia materna
children
exclusiva
can
y puedan
be
seguir continuando con
breastfed
lactancia
exclusively and may
una vez que
continue
inicien
being
su
breastfed
alimentación? Por favor, Ana
once
Lucía,
they
adelante.
also start getting other
Pues yo
food
creo
in
que
addition. Ana
muchas de las
Lucía,
estrategias que se han implementado
many of
funcionan,
the strategies
pero
that
a
have
mí me
been
gustaría
implemented
ver
work, but I would
de
like to
recomendaciones de
see
Organización Mundial de la Salud y de UNICEF de la
WHO and
importancia de la
UNICEF
educación
recommendations about the
oficial en
importance of
lactancia de
official
los profesionales de
education
salud.
in
O sea,
breastfeeding
debería
by
ser
health
una materia
professionals. This
obligada
should be
de
a
medicina, de
mandatory
psicología, de
subject
enfermería,
in medicine,
porque mientras
pediatric
los médicos,
psychology,
mientras
but
todo el personal de salud
as long
no
as
esté
all
con unos
health personnel
estándares
does not have
universales de
universal
promoción
standards
y
to
que tengan muy
promote
claro
breastfeeding, and
qué
as
es
long
lo
as
que
they don't
deben
know
decir,
clearly
no
what
vamos a
it
lograr
is,
nada.
what
Hace
they
más o
need to
menos un
say,
mes
we
di una
will not
clase
achieve
para,
anything.
hay una
About a month
clase de
ago, I
medicina
gave a
en
class,
la
a
universidad,
medicine
en
class,
el hospital en el que yo trabajo.
in the
Y les pregunté
university
a todos,
hospital
¿ustedes
where I
saben qué
work,
es el
and
plan
I
decenal de lactancia materna?
asked
¿Ustedes
everybody
saben
if
qué
they
es el código
knew
de
what
sucedáneos
was
de leche
the
materna?
10-year breastfeeding
Ninguno
plan,
sabía.
and no one knew that
¿Ustedes saben
or
qué es una
about the
lactancia
code.
libre de demanda?
Do you
Ninguno
know
sabía.
what is a
Hasta que
demand-free
nosotros no seamos
breastfeeding? No
capaces de
one knew that.
educar a
unless
los
we are
profesionales de
able
salud,
to
no
educate health
desde lo que
professionals,
oyen, sino como una materia
not
más dentro de su
from what they
formación.
hear, but
No
one
creo que
more
todo el
specific
trabajo que nos
subject in their
desgastamos
training.
diariamente haciendo con la
Our
comunidad, las
daily
pacientes
work
y sus
for
familias
communities, patients
sea
and their
el mejor.
families
¿Por qué? Porque
will
me
not
pasa
be
todos
the
los días
best.
en
Why?
consulta.
Because
Han ido
I
conmigo,
see
se
this
han
daily.
preparado, pero en el
Health
hospital
professionals
pasa
have
lo que acabo de
declared
mostrar.
that
Se sacó
in the
2 centímetros de
hospital
calostro y le dijeron, ¿para qué? Mejor
we
bote
have what I
eso.
showed.
Entonces,
They had
si
2
seguimos
centimeters
haciéndolo
of
así, no vamos
colostrum
a
and they
lograr
said, why did
mucho de
I
lo que
throw that?
necesitamos hacer.
Unless we give clear
No,
guidelines,
muchas
we will
gracias.
not attain those
Tocas
goals.
un tema muy
So thank you very
importante,
much.
el de la
This is a
formación
very
del
important topic,
profesional,
that
y
of
has hecho
the
énfasis en los
training of
médicos,
professionals. And you have
porque a
laid
pesar de que
emphasis
los niños
on
tienen y
doctors
las madres
because
tienen contacto
even
con
though
enfermeras, con
infants and mothers have
técnicas de
contact with
enfermería
nurses
o obstetrices
or
en los países en los que existen,
obstetricians and where
los
they
médicos
exist,
siguen teniendo mucha
doctors
influencia. Lo que ellos
continue
dicen
to being
influye
very
mucho en las
influential
familias,
because what they
y ese es un tema
say
que a lo
has
mejor
a
nos
big
falta ver con un
influence in
poco más de
families,
cuidado.
and we
¿Alguna
have to
otra
see this
idea,
more carefully.
Elisa or
Any
Marcel?
other ideas,
Any
Marcel,
suggestion?
Elisa?
How can we accelerate our efforts so that we can reach a higher prevalence of exclusive breastfeeding? Por favor, Elisa, adelante.
Okay, Elisa, please.
Voy a unir esta pregunta con una que estaba en el chat y tiene que
I
ver con
will
las
join this
transformaciones
question to
sociales.
one
Ese ha
in the
sido
chat that
como
has to do
una de
with
las
social
apuestas grandes que tiene
transformations.
el plan decenal,
This has been
y
one of
es
the
cómo
important aspects
dejamos
in
de
the
ver la
10-year
lactancia
plan.
materna solo en el
How
sector salud, que es muy
to
importante y altamente
see
relevante por el rol
breastfeeding
que
in the
jugamos,
health sector,
pero
which
también
is
es un
very
compromiso
relevant,
de
but
sociedad.
it's also
En mi presentación
a
mencioné la
society commitment.
estigmatización que tienen
I
las madres de
mentioned the
lactar en público
stigmatization
y de por qué
breastfeeding mothers
muestra sus
who
senos en
breastfeed in
público, por qué
public.
en los medios de transporte.
Why
Entonces,
in
¿cómo
public? Why
logramos ese
in means of
cambio social
transportation?
en
How
pro de
do
la lactancia
we
y que
achieve
todos
that
seamos defensores de la
societal
lactancia?
change
Eso nos
in pro
ayudaría mucho a
of
cambiar esos
breastfeeding?
imaginarios
This
que
would
tenemos que
allow us to
lactar es algo que debe
change
pasar pues allá en la habitación
perception
como
that
si fuera algo
breastfeeding is
secreto,
something
a
private or
volverlo
secret
la
to be
forma natural
conducted
de
in a room,
alimentación
and to
y
change
volverlo
the
lo
perception,
común, lo
to
usual.
make it
Eso es lo usual. Lo
to
usual no es ver un biberón a un niño con un
make
biberón, sino lo
breastfeeding
usual
be
es
a
ver a
common
una
feature
mamá
in
con su
public,
bebé lactante.
just as a
Entonces,
feeding
volver
bottle.
eso común
So
es un
this
gran
is a
reto y es
big
una de esas
challenge
transformaciones
and
sociales que me parecen
entails
de
a
las más difíciles.
societal
Si todas tienen
transformation
muchos
which is
retos,
very
estos me parecen
difficult, and there are
No,
many
muchísimas gracias por
challenges
tocar
in
ese
that
tema.
respect.
Y
Thank you very much for
como lo han dicho
touching on
los
this.
tres
As the
panelistas,
three panelists have
eso
said,
requiere no solamente un
this
trabajo desde el
requires not
sector
only
salud,
a
requiere un
work from the
involucramiento
health
de
sector,
todos en
because
la
it needs
sociedad,
to involve
desde el puesto donde están,
the
sector
whole
privado,
of
sector
society,
público,
the
las
public sector, the
organizaciones
private
civiles,
sector,
las
civil
organizaciones ligadas a la
organizations,
iglesia, etcétera, el
church
mismo público que
organizations, etc., and
vayamos
the public
retomando lo
itself.
que alguna vez en algún momento fue algo
That
considerado como
goes back
natural,
to
¿no?
something that
Como normal,
many
pero que
years
lo
ago
hemos ido
was
perdiendo por muchas
considered
razones.
normal
Marcel,
and
do you
regular,
have
but we
any
lost that.
suggestions, any idea,
Martel.
any recommendations?
Right. Just to add that a targeted approach is needed for the breastfeeding rates to be increased and be sustained. So in many cultures, there are myths that need to be addressed. And unless those myths are addressed, we won't have increases in the breastfeeding rates. Myths that, in Jamaica, for example, the myths include persons thinking that expressing breast milk is nasty. So caregivers do not want to feed the expressed breast milk to the children. They think that breastfeeding up to 6 months, breast milk alone is not adequate for children. And so those myths have to be addressed through educational campaign, targeting the caregivers and key persons in the organization. There's also a need for policy directive. So we're encouraging mothers to breastfeed, but they return to work. So what is in place at the workplaces to support mothers to breastfeed? So we have to look at having a support system in place in the workplaces, including a place for mothers to express and store their milk, maternity leave as well. We also need to look at paid breaks for expressing breast milk, so that there is a supportive environment in the workplaces that will facilitate breastfeeding.
Yeah.
All right, so the targeted approach includes looking at activities targeting persons, the key persons, such as the grandfather, the grandmothers, and the fathers, so that we can see results. And there's a need for the governments to invest financially in breastfeeding. We look at marketing of other products, but when you look at the investment for the marketing of breastfeeding, the money is small in comparison to how companies may market food items. And so we need to see breastfeeding as a priority and pump or invest the finances necessary in order to promote exclusive breastfeeding and to ensure that we have that supportive environment in place for it.
Muchas gracias. Sí, lo que ustedes
Thank you very much.
acaban de señalar
What you have
lo están
just
ratificando nuestros
indicated
participantes en la
is
sección de preguntas,
being ratified
donde
by
ellos
our
hablan sobre la
participants in
importancia
the
de
Q&A, where they
educar
mentioned
y
the
informar al
importance of
personal de la salud
educating
sobre
and
cumplir con el
informing health
código.
personnel about the importance of
Y como tú
complying
has
with the
mencionado
code.
muy bien,
And just
Marcel,
as you have very well said, Marcel,
necesitamos
we need
conocer mejor las razones por las cuales las
better
mujeres
knowledge about the reasons
inician la
why
lactancia, pero luego
women
la suspenden
initiate breastfeeding, but
o
then suspend
empiezan
it, cut it off,
a
or they
utilizar, son más atraídos
they
al
feel
biberón
more
para poder
attractive to bottle
responder a esas
feeding.
dudas que tienen.
We need to
de
respond to their
¿Qué es lo
doubts.
que está detrás de pensar de
What
que
is
extraerse
behind
la
the
leche es
thought
un
that
proceso no
extracting their own
deseable?
milk is an undesirable
¿Qué es lo que está
process?
detrás de eso?
What underlies that false
Nuestros colegas, los
perception?
comunicadores, nos dicen de que
Colleagues,
para
communicators say
poder responder
to
mejor
be
a
able
estos
to better
mitos,
respond
no
to
pasa
these myths,
necesariamente con negar los mitos y dar más
it is not
información.
enough to
Es
deny
necesario una
the myths
comunicación
and give more information. We
interpersonal más
need an
cercana, pero
interpersonal and
también
closer
tener un
communication,
ambiente, como
but
ustedes nos
also
dicen,
to
que
have
está
a
elevando el
conducive
valor que
environment
tiene la
that
lactancia
increases the
materna,
value of
como,
breastfeeding,
no solo
not
como alimento,
only
como lo dijo muy
as a
bien
source
Pablo
of
en algún
food,
momento,
as
y ustedes lo han
Pablo
ratificado.
said
La
very
lactancia
well,
materna
and
tiene
you
muchos
ratified,
otros beneficios
breastfeeding has many other
para
benefits.
el niño, por
For the
supuesto,
child,
para
of
la
course, for the
familia, para la
family, for the
mujer,
woman,
pero también
but
para la
also for
sociedad.
the society
Entonces
at
hay
large.
algo ahí que
So
tenemos que hacer
we
muchas
need
cosas
to do
juntas,
many
y ahí el
things
financiamiento
at
y
the
el
same
apoyo
time.
es
There's
muy
and
importante. No puede
financing
ser
and support
un
is very important.
financiamiento
We
solo
cannot
en un momento, sino
implement
continuo.
financing at a
Quizás
specific
estamos en
time,
este
but there has to
momento,
be
tenemos ya mucha
continuous
información
financing.
acerca
We
de qué es
have a
lo que hay
lot
que
of
hacer,
information, a lot
pero
of information
nos
about
está
what
faltando
needs to
conseguir
be
que
done,
esto
but
sea
we still need
considerado una
to be able
prioridad
to
sostenible.
make
Y
this,
quizás
to be
estamos en
considered
ese
as a
momento
sustainable
de
priority.
reavivar ese
And we are
movimiento que
at the
alguna vez
time
lo
of
hubo, un movimiento
reigniting
regional por la
the
lactancia
old
materna que fue muy
regional
potente.
movement
Hay que
on behalf
reactivarlo
of
esta vez
breastfeeding.
como
That was a
región,
very
pero
powerful
al mismo
movement.
tiempo
We need to
en cada
reignite
país,
this movement at
para
a
poder
regional level and
avanzar.
in each
Tenemos
country
muchos retos
to
y los retos se han
progress. We have
complejizado.
many complex
Pero
challenges
no
ahead.
hay una sola
And
intervención
there
que
is
nos va a ayudar. Hay muchas cosas que hay que hacer al
no
mismo tiempo
single
con muchos
intervention
actores
by
para
itself
poder
will
lograr
be
este
enough.
cambio y que sea
We need to
sostenible,
have
¿no?
many interventions with many actors at the same time.
Uno de los participantes
One of the
sugiere aquí
participants
que
suggests
inclusive
here
la educación vaya a
that education
desde la educación de los niños,
should
que
go
también
from
ahí
the
se
education of
incluya.
children,
Es
and that should be included
una
there.
idea muy interesante,
This is a very interesting
sobre todo en
idea,
este momento en el que
especially at this time
muchos niños, el número de niños por familia ha
when the
reducido,
number of children
y
per
las
family
madres que están siendo
has
madres por primera vez
dropped,
quizás
and
no han tenido mucho contacto
first-time
de ver a
mothers
otras mujeres
have
dando
not
lactancia,
had
o no han
the
recibido
possibility of see other women breastfeeding,
esa
or they
experiencia
have not
positiva que
received that
antes era muy
positive
natural.
experience
Por
that
eso era natural, porque se
many years
veía
ago was very natural. That
las
was
vecinas, todo el mundo daba de lactar. Ahora
everybody was
es un
seeing
tema diferente,
breastfeeding
¿no?
in public, but this has
Quizás
changed and has to be addressed.
completar lo que ustedes
And to
están,
complete what you are
nos están mencionando,
mentioning,
quizás nos pudieran decir,
maybe
en En lo que,
you could
en la experiencia de ustedes,
say, in your experience,
¿cuál es el rol que ustedes le ven
what role do you see
digamos, ya no tanto a los profesionales de la
for
salud,
not
sino a
so much
otro tipo de
for
profesionales?
health professionals, but for other types of
Lo que
professionals
trabajan quizás en la sociedad
professionals
civil, en
working
las
in the
organizaciones de
civil
la,
society
que están trabajando
and
directamente y que de alguna
organizations
manera están
working
conectados
directly
con
and
los
are
ministerios de salud o con el Ministerio de
connected
Desarrollo
to
Social o
health
con algún otro
ministries or
ministerio.
social
¿Le ven
development
ustedes algún
ministries or
rol?
other ministries.
¿De qué
Do
manera en la
you
experiencia de sus
envisage
países de poder
some roles
aprovechar ese
based in the
potencial que hay
experience
en
in
la
your
sociedad
countries
civil
to
o en
take
las
advantage of the
comunidades organizadas
potential
para
in
poder
organized
elevar el valor, la
communities or civil
importancia de la
society
lactancia
to
materna? ¿Tienen
enhance the
ustedes
value and
experiencia
importance
y cómo,
of breastfeeding? Do you
cómo
have
les ha
any
resultado esta
experience in that
experiencia?
respect?
Sí, por
And
favor,
what
Elisa.
has been
Sí.
the result of that experience? Elisa,
Bueno, yo
please.
creo que un rol muy importante
A very
son las
important
personas
role is
encargadas
in
del
the
área de
people
talento humano de las empresas, en la medida de cómo
of those
garantizan un
addressing human
entorno
resources and
favorable para la
human
extracción
talent
de
in
leche y
companies.
el almacenamiento de leche
For
materna cuando
example,
la madre
in
debe regresar al trabajo.
establishing when mothers go back
Entonces,
to work,
cómo
they
se
need to have
facilitan
a
estos
favorable
espacios y
environment to
estas
extract
personas en
their own
especial
milk.
tienen ese
And these
poder al
human
interior de la
resources people
empresa
have that power
de que
inside a
surja
company
la sala o que
to
sencillamente no se
create a
dé.
breastfeeding room,
Y
for
ahí
example,
a la par tenemos
or
un
not.
reto y
And
en
we also have
Colombia
a challenge in
especialmente y
Colombia
es la
especially,
informalidad
and
laboral.
that is
Entonces
lies in
tenemos
the
muchas
work
personas que no forman
informality.
parte de
Many
la
people
vinculación laboral,
are not in the
sino
formal
que
work
están
sector,
en la calle, son
but
vendedores
for example,
informales y
are
son madres
informal
que están con sus bebés y no tienen esos
salespersons in the
espacios,
streets,
pero
mothers with their
tampoco
babies that
está
don't
muy
have
claro
private
cómo
spaces.
poderlos hacer y
And
cómo
it is not very
mantener
clear to create those
las
spaces and
prácticas
how to
sanitarias
maintain
adecuadas para garantizar
adequate
que no
health
haya, por ejemplo,
practices to
contaminación de la
ensure that
leche
there's
u
no
otras cosas.
contamination of
Entonces eso es un
milk
reto
and similar problems.
y
This
yo
is a
creo que un
challenge
actor muy importante y sobre todo
and a
cuando
very
uno va a
important
escenarios
actor, especially
internacionales es el
when you
Ministerio de
look at the
Comercio y su red de
international
Codex
area, is
Alimentario.
the Trade
Y
Ministry
cómo somos
and their
compañeros
limitations
del comercio,
with
vamos
the
juntos a
Health
espacios
Ministry and
como
Trade
el
Ministry, and we
Comité de
go together to
Nutrición y
the
Alimentos
Nutrition Committee
Regímenes
of Special
Especiales,
Food,
donde
where
se
we
discuten
address
estos temas y
these
sin duda la
topics,
posición tiene
and
que
the
ser
position
en proteger
has
la
to
salud
protect
pública.
public health.
Entonces, también como este
And
ministerio
so
se solidariza
that
con el
ministry
rol de protección de la salud por encima de su función constitucional
understands
que está
the importance
relacionado
of
con la
the
industria y
protection of
demás.
health, in addition to protecting
Muchas
industry,
gracias,
of course.
Elisa.
Thank you very much, Elisa.
Ana Lucía, Marcel, do you have any experience with non-health sector con otros o sociedad civil? Sí, Ana Lucía.
Hay otro sector que no tiene un gran peso
There's another sector
gubernamental,
that has not a
pero
big
es muy
weight in the
importante.
government, but it's nonetheless very
Hace un
important.
tiempo dicté varias
few
conferencias en
times-
jardines infantiles,
A few,
porque
short
las
time ago,
guarderías y
I
los jardines infantiles
made a speech at
tienden,
kindergartens
por lo menos en
because
Colombia,
childcare
mucho a
and
decir,
kindergarten
pero
centers
tú, ¿por qué
tend
sigues
to
lactando a ese
be in
bebé tan
Colombia. Why
grande?
do you continue
Y
breastfeeding
cuando un
such
bebé
a
está todo el día en un
old
jardín o
baby,
en una
when a baby
guardería
is
y
the
tiene
whole
más de
day
6
in a
meses,
kindergarten or a
es como,
childcare
déjame el
center
tarro
is older
y aquí le
than
hacemos la
6
fórmula.
months,
No, mira,
and
yo tengo
is
leche que yo me saco y
fed
te la traigo.
formula fed,
No,
bottle
pero es
fed.
que para
No,
refrigerar eso es
and
muy difícil. Además,
the
ya tiene un
caregivers
año, ¿ya para
say
qué le
this is
sigues
very
dando?
difficult
Nosotros
to
no podemos recibir
refrigerate
leche
milk. We
tuya
cannot
acá, pero
receive
déjanos el tarro.
your own milk,
Entonces, los
saying to
jardines
the mother.
infantiles y las
So
guarderías
kindergartens
también
and
tienen un
childcare
papel muy
centers have
importante
a very
y podrían
important role in
educar a la sociedad
promoting
como diciendo,
the
así este
use
niño
of
tenga 3 años,
maternal
si tú le
milk.
sigues
So
dando,
if
pues
you
nosotros te
continue to
recibimos la
give
leche.
your milk
Pero
to your
creo que
baby or your child,
ahí
even
falta
if
también.
he or she is 3
No,
years old, we will
gracias por el
help you in
comentario
that.
de un
Yes,
sector
thank
muy
you very
importante.
much. This is a
Marcel,
very important sector.
yep,
Marcel,
and then we close.
and
Okay,
then we
so,
close.
right. So in Jamaica, we have a National Infant and Young Child Feeding Committee, which is a multi-sectoral committee comprising of members from other ministries and other groups. And at this committee level, there is a plan that is developed and integrated comprehensive plan that includes activities with roles for different organizations or ministries. Similar to that, at the parish level, we have parish infant and young child feeding committees, and these committees have representatives from the other ministries as well as community groups. And so through these committees, we're able to refer persons who are in need of assistance. So for example, if there are persons in the parishes that need financial aid, they are able to be referred to the Ministry of Labor and Social Security, and then they're placed on the PATH program, so they receive subsidies to assist them, right? And then we have the Early Childhood Commission, and the Early Childhood Commission is a part of the committees at the various levels. And the Early Childhood Commission has developed nutrition standards for early childhood institutions, and they monitor the implementation of these nutrition standards in their early childhood institutions. And so we're able to work as a group to implement activities pertaining to infant and young child feeding while identifying the role for each organization and monitoring the activities based on the monitoring and evaluation framework that is in place at the different levels. And I think that is useful because then infant and young child feeding is not just a role for the Ministry of Health and Wellness, but the other stakeholders see their role, the responsibilities that they have, and they're able now to implement these activities.
Muchas gracias, Marcel, Elisa,
Thank you very
Ana
much,
Lucía.
Marcel,
Y con
Elisa,
eso
Ana Lucía.
cerramos esta
Let's
sesión.
say I wanted to make a point.
Yes, Audrey.
When you were asking about the role of different sectors of the society, and I think that one that's very important is the policymakers and the legislators. And as I pointed out in the presentation, so far we have, out of all the 35 member countries of PAHO, 2 countries have legislated the code in its entirety. And so I think, the code report did make the recommendation that those who have legislated only a part of the code need to increase that, improve on that, while of course the 16 countries which have done nothing so far need to do that, because the environment is very important. So while we can be working on the support in terms of education and what is being done in terms of educating mothers, training nurses, what is being done by the nutritionists and dietitians and the committees, but the improving the environment has helped with the marketing of foods generally. So we need to improve on the environment where marketing of breast milk substitutes is concerned.
Muchas gracias Audrey. Y con eso cerramos. Les agradezco mucho, hay mucho para seguir conversando con esto, pero ya nos hemos pasado de la hora límite. Muchísimas gracias a los panelistas y a los participantes. Over to you, Leo.
Muchas gracias, Betsy. En realidad es un tema muy importante. Podemos seguir y debemos seguir hablando mucho de este tema. Desafortunadamente no hemos podido tocar todas las preguntas, pero por favor nos envían un correo electrónico que pueden usar el correo al que recibieron el vínculo de este webinar. Entonces, con gusto estamos apoyándoles en responder a esas preguntas. Me dicen que no usar el correo de inscripción. Entonces, por favor,
advised
miren
not
el
to
chat
use the
donde vamos a poner el
registration
correo que pueden,
email. So
que
look at
pueden
the chat
escribir
where we
para
will put
responder
the
a
email address
esas
to,
preguntas,
where
porque
you can
tenemos algunas
write
personas de vacaciones. Entonces,
and send your
no queremos
questions. We will
demorarnos con
respond
las
your questions. And
respuestas.
some people are
En
on
todo
vacation
caso,
and we
hemos
don't want to
escuchado
delay our
presentaciones que
responses.
han
We
resaltado
have
el hecho de
listened to
que la lactancia
presentations that have
materna
stressed the fact that
óptima
breastfeeding,
reduce el
optimal
riesgo de
breastfeeding,
malnutrición,
reduces the risk of
incluyendo
malnutrition,
la desnutrición
including
aguda, talla baja y
acute
sobrepeso y obesidad.
malnutrition, stunting,
La
overweight, and
práctica
obesity.
óptima de la
The
lactancia
optimal
materna
practice of
necesita
breastfeeding
protección,
needs
promoción y
protection,
apoyo para
promotion,
por
and support
trabajadores de salud competentes,
for
protección de
competent
prácticas
health
inadecuadas de
workers,
comercialización de
and
sucedáneos de la leche
fighting
materna
against
y
inadequate
apoyo a la mujer
marketing practices
trabajadora
of
por familias y comunidades.
maternal
El
milk
apoyar la
substitutes.
lactancia
And we need
materna
to
incluye
support
muchos actores
breastfeeding,
y niveles.
including
Las
different
mujeres
stakeholders and
necesitan
levels.
apoyo en el
Women need
establecimiento de
support in the
salud, el
establishing
lugar de
health
trabajo y
facilities,
la
their
comunidad
workplace,
a
and the
fin de practicar
community
la lactancia óptima,
to practice optimal
progresando de un
breastfeeding,
nivel a otro.
progressing from
La
one level
OPS
to
ha
the next.
enfocado en
PAHO
resaltar
has
la importancia de
focused
la lactancia
itself
materna con
in
el
stressing the
objetivo
importance of
de no solo
breastfeeding with the
apoyar a la
goal of not
mujer,
only supporting
sino
women,
también
but
lograr la
also
reducción de la doble carga de
maybe
malnutrición. La
reducing
lactancia
the
materna
double
juega
burden
también
of
un papel
malnutrition,
importante en
and
los
breastfeeding
sistemas
is also
alimentarios
important in
como el mejor alimento
feeding
para los
system
niños
as the
desde el
best
nacimiento
food
hasta los
for
2
children
años o
from
más,
birth
de
to
acuerdo
2
con
years
lo
or more of age,
recomendado por la
according
Organización
to
Mundial de la Salud.
WHO
Este año,
recommendations.
durante la
This year,
celebración de la
during
Semana
the
Mundial de la Lactancia Materna, la
World
Organización
Breastfeeding Week,
Panamericana de la Salud
PAHO
llama a los gobiernos a que
calls upon
impulsen sus
governments
esfuerzos para
to
priorizar la
enhance
inversión en
efforts to
normas y programas de
prioritize
lactancia
investments
materna,
in standards and
especialmente en
programs of
contextos
breastfeeding,
frágiles e
especially in
inseguros.
fragile and insecure
Equipar a
contexts.
los
We need
trabajadores en salud y
to
nutrición en
equip
establecimientos y
health and
comunidades
nutrition
con
workers
las
in
habilidades necesarias
facilities
para
with the necessary
proporcionar
skills
asesoría de calidad
to
y apoyo
provide
práctico
quality
a
advice
las
and
madres para
and
que
hands-on
amamenten
support
con
for
éxito,
mothers to be
proteger a los
successful
cuidadores y
breastfeeders, and we
trabajadores en
need to
salud de la
protect
influencia
health
de prácticas no éticas de
healthcare
comercialización por la industria de fórmulas
caregivers,
mediante la
to
adopción
protect them
total
from
e
the
implementación
industry
del Código
malpractice. And
Internacional
we need to
de
promote the
comercialización de
total
sucedáneos de la
implementation
leche
of
materna,
the international
incluyendo
code
en
for the
situaciones
marketing
humanitarias,
of
e implementar normas amigables a la
maternal milk
familia que
substitutes. And we
proporcionen a
need
las mujeres
to
el tiempo,
implement
espacio y apoyo que
family-friendly
necesitan para
practices
practicar la
to
lactancia
give
materna.
the women the space and support they need
Esperamos que
for
los
breastfeeding.
gobiernos
We
sigan
hope
estas
that we
recomendaciones y
expect governments to
comprometemos el
follow
apoyo de la
these
OPS
recommendations, and we commit
para aumentar
our
las tasas
support
de
to
lactancia
increase
materna
breastfeeding
y la
rates and the
implementación del
implementation
código y la
of the
iniciativa
code and
Hospitales Amigos
the
del Niño. Y quiero
baby-friendly
anunciar también
hospital initiative.
que
And
en
I
estos
also want
días
to mention
vamos a
that in the
publicar
next few
en la
days, we
página
will
web
publish
la
on our
traducción al
webpage
español
the Spanish
de los
translation
materiales de capacitación
of the
para
training
el
materials
personal de maternidad sobre la
for
iniciativa Hospitales
maternity
Amigos del Niño, que nos
personnel
ha
about the
tomado
baby-friendly.
bastante
It has
cargo, pero
taken a
es muy
long time
útil
because it's
que
a very long
finalmente lo vamos a
package,
tener
but
en
it is good
español.
that we will
Y
finally also have
esto
it
y
in
todos los
Spanish.
otros materiales
Well,
lo
this
pueden
and all the
encontrar
other materials
en la página web
will
de
be
lactancia materna
on the
de la
breastfeeding webpage
OPS.
of PAHO.
Entonces les invito
So
a
I
que
invite
regularmente y frecuentemente
to visit
consulten esta
this
página.
webpage
Ahí también
regularly
están
and
los
frequently,
videos que hemos
which also
mostrado en
contains
este
the
taller
videos
y
that
van a
we have
encontrar también
shown in
la
this
grabación en
workshop, and
inglés,
you will
portugués y
also
español.
find the
Yo quiero
recording in
agradecer
English,
mucho a los
Portuguese, and Spanish. I
panelistas,
want to thank very
también a
much
los
the panelists
traductores
and
que nos
also
han
the interpreters
acompañado
who
y
have supported
finalmente a
us,
todos
and finally also
los
all
asistentes, los
attendees
participantes de
and
este
participants
webinar.
at this
Seguimos
webinar.
apoyando, seguimos
We will
estando en
continue
contacto,
supporting
siempre
you, and
nos
we
pueden
will
contactar
continue being in
y
contact. You
escribir
can
y deseo
always
a
contact
todos
us
una
and write to us.
feliz tarde
And my
y
best
hasta la
wishes
próxima.
for a good afternoon for all of you. See you next time.